stents, artificial heart valves and artificial hearts. So evaluate the use of stents, evaluate the use of artificial heart valves, evaluate the use of artificial hearts. Surgery and stents. Heart muscle needs oxygen to contract efficiently. So oxygenated blood is carried to the heart by the coronary arteries. So the coronary arteries supply the heart itself with blood. In coronary heart disease, there's fatty material which builds up inside coronary arteries and causes them to become narrowed. That reduces the flow of blood through the coronary arteries, so the heart muscle beyond that gets less oxygen. And sometimes the flow of blood to part of the heart muscle stops completely, and unfortunately the affected muscle tissue dies, and that is what is known as a heart attack. So there's two methods of treating coronary heart disease, and that is bypass surgery or stents. The bypass surgery is where a piece of vein from the leg or arm is used to create a bypass around the blocked part of the coronary artery. And it needs general anaesthetic and takes about 7 days in hospital and about 3 months to fully recover. The next one is a stent. A stent is where you use a metal mesh, a bit like a garden trellis that you put plants on. A metal mesh which props open an artery. So first of all the stent's collapsed to a small diameter and put over a balloon attached to a tube, and then the catheter is inserted, that's the name for the tube, the catheter is inserted into a blood vessel and manipulated into the area of the blockage. A stent, that's where the balloon is inflated, the stent expands, it locks in place and forms a scaffold and then holds the artery open. Then what you do is remove the catheter and the stent stays in the artery permanently and holds it open and improves the blood flow to the heart. The only problem is that fatty substances can build up in the stents. The good thing is that it only takes about 1 to 2 hours. You can do it under local anaesthetic and the patient stays overnight and they can be back to normal within a week. But the problem is fatty substances can build up. So it's actually better to use bypass surgery because there would be they're less likely to have fatty material building up again. But the bypass surgery recovery time is a lot longer. So heart valves, replacing heart valves. Most people's heart valves are fine throughout their whole lives, but sometimes they become faulty. And that's either because they become stiffened, so they don't fully open, or the heart valve becomes leaky. So you can either use biological heart valves, usually from pigs, or mechanical heart valves, which are made out of carbon. So the mechanical heart valves have 2 carbon leaflets on hinges. They swing open completely in the same direction for blood, and then they close again periodically. So mechanical valves are strong and last a lifetime, so they're good to be used in young patients, but the only problem is they can damage the red blood cells because they're a bit harsher, so they increase the risk of blood clotting. So to minimise the risk to patients, they take an anti-clotting drug for the rest of their life. Biological valves, what they usually do is replace the valve in the aorta with the patient's own pulmonary valve, then replace the pulmonary valve with a valve from the pig's heart, and that is because the pulmonary valve doesn't cope with as high a pressure as the aortic valve. So biological valves don't damage the red blood cells, so that's good, but they can become hardened with calcium deposits after some time. So if the heart disease can't be treated by either stents or artificial heart disease, and for some patients the only option is either to have a heart transplant, but it's not always possible to get a donor, or you can have an artificial heart. Now, artificial hearts are still at the experimental stage and they're not actually that successful. Artificial hearts require both external and internal power supplies, so if something goes wrong with the power supply, then that's quite a major issue. Okay, artificial blood. So we could overcome some problems of associated with transfusing natural blood. So blood group issues, any infections that the blood might contain. Artificial blood could be sterilised to prevent infections being transmitted and avoid problems with mismatching of blood groups. Could be stored for longer periods, etc. Two types of artificial blood. There's HPOCs made from haemoglobin. Doctors can't transfuse the haemoglobin itself because it quickly disintegrates once it's transfused. So you can bind the haemoglobin to a synthetic polymer. However, that polymer only remains in the blood for about a day compared to a 100-day life of a red blood cell. And there's PFCs, which are entirely synthetic, and you need to supply the patient with extra oxygen for this to work. They're a lot smaller than red blood cells, and so they can be used to supply oxygen to places that can't be accessed by red blood cells, such as through swollen brain tissue. Now, HPOCs and PFCs still produce some side effects, so it's not quite perfect yet.